the case of EGFR, what we've noticed is that the drugs that we use, the tyrosine kinase inhibitors, bind both to normal, or what we call wild-type EGFR, and they also bind to the abnormal mutated EGFR. They have very little effect on the wild-type. They have almost no effect on the function, but the abnormal protein is very sensitive to it. So it's all about, it's a target drug interaction that is very specific for the abnormal protein, and that's why it works so well. So even if you have regular EGFR everywhere else, doesn't matter, the drug is not going to affect its functioning nearly as much as the abnormal. What they're doing now is they're looking sort of at 3D structures of proteins, right, and trying to design a drug that, so if it's this mutation, the drug will fit in this little pocket and inhibit the protein. So they're getting to the point where they're trying to design very specific, that's one approach. The other approach is they make these drugs which block a whole family of similar receptors, and that seems to work in some cases, because what happens, for example, with EGFR is if you inhibit the EGFR pathway, another pathway becomes engaged, and then that one can actually overtake, and the cell can become resistant. So they find if you initially attack both pathways at the same time, there's no chance for a second backup pathway to develop. So they're learning about how to overcome this resistance, how to attack the growth pathways, when and how to do it.